This presentation provides general information about Title IV Part A. The information is based on current understanding of state and federal regulations. However, regulations can change, so the information in this presentation may also change. For specific advice, please consult with a legal professional. The Title IV Part A Capacity Building Initiative is a partnership between Region 14 and Texas Education Agency to support ESCs and LEAs with their Title IV Part A journey. If you need assistance, please reach out to any member of our team and we are happy to help. Title IV Part A funding can be a powerful tool for boosting student academic achievement, but navigating its guidelines can sometimes feel like a puzzle. Throughout the presentation, we'll be connecting the dots between the different elements of Title IV Part A, providing you with an overview of the basic components and how they benefit schools and districts, conducting comprehensive needs assessments, setting objectives and measurable outcomes, and understanding research-based proven effective strategies. As a reminder, you can scan the QR code on the screen to access the presentation resources. This QR code will be on each slide throughout the remainder of the presentation. Title IV Part A is part of a federal funding program, Every Student Succeeds Act, or ESSA, that is designed to help local education agencies improve student achievement. In Texas schools, this funding plays a crucial role in supporting a variety of initiatives aimed at enhancing student outcomes. Some key objectives include improving student achievement by establishing programs or activities to assist students in meeting challenging academic standards, increasing engagement by implementing programs that provide a safe, healthy, and supportive school environment where students are more likely to be engaged in their learning, preparing students for the future through a well-rounded education where students develop the skills and knowledge they need to succeed in college and careers, and ensuring equal educational opportunities to all students through access to high-quality education. By providing funding for evidence-based programs and interventions, Title IV Part A empowers schools to implement strategies that address the unique needs of their students and promote academic success. I want to spend a few minutes on the application-related requirements for Title IV Part A funding. The first step is to conduct a comprehensive needs assessment. Carrie will discuss the CNA in more depth soon, but it is good to remember that best practice for all districts is to complete a needs assessment annually. A district's unique funding allocation will determine the federal requirement for conducting a needs assessment for Title IV Part A. The next step is to submit the application, which is comprised of two parts. The first portion is the ESSA Consolidated Federal Grant Application Title IV Part A, which is PS 3107. This includes information about the district, a needs assessment, program goals, and the budget. The second portion of the application is the ESSA Consolidated Federal Compliance Report, PR 3107, which includes information about program implementation, student outcomes, and use of funds. Both forms are critical for receiving and maintaining Title IV Part A funding in Texas. Accurate and complete submissions are essential to ensure compliance and maximize program effectiveness. Districts should carefully review the guidelines and instructions provided by TEA when completing these forms. Next, districts must report on progress toward their specific objectives and measurable outcomes to demonstrate the impact of these funds on student success. John will cover this process in more detail shortly. The evaluation of effectiveness for selected activities under Title IV Part A aims to measure the impact of funded programs on student outcomes, such as improved academic achievement, school safety, and mental health. This evaluation helps districts identify successful strategies, allocate resources effectively, and make data-driven decisions to enhance student well-being and learning. Finally, there are also two application-related assurances I want to highlight. Title IV Part A funds must be prioritized for distribution to schools with the greatest need, as identified by the LEA's Comprehensive Needs Assessment. LEAs must consult with stakeholders and private, nonprofit, equitable service providers to determine how to best allocate funds to meet the needs of all students. Title IV Part A annual public reporting requirements mandate districts to publicly disclose how federal funds are spent on improving student achievement, as well as the progress made toward the program goals. The reporting process aims to foster transparency and accountability in the use of these federal resources. The ESSA Consolidated Federal Grant Title IV Part A provides funding for a variety of programs and services that support student success. These programs fall into three broad content areas. Well-rounded education focuses on providing all students with a comprehensive education going beyond the Texas required academic standards. Programs could include arts education, career and technical education, and extracurricular activities. Districts must remember to be very cautious about supplementing and not supplanting their funds. Safe and Healthy Students focuses on creating a safe and supportive learning environment for all students. Programs in this content could include counseling services, mental health support, and substance abuse prevention programs. It's important for districts to remember that they need to go above and beyond any state requirements related to these programs and make sure that they are supplementing and not supplanting any state requirements. The third content area is effective use of technology. This area focuses on integrating technology into the classroom to enhance learning through professional development of teachers and staff. Programs through this content area could include professional development for teachers, access to technology devices, and online learning resources. By funding these content areas, Title IV Part A helps ensure that all students have the opportunity to succeed in school and in life. There are a number of benefits for schools and districts related to Title IV Part A funding. Some include developing new courses and activities to provide students with a well-rounded education, providing teachers with professional development they need to effectively implement new programs and strategies, offering counseling and other support services to students who need help with academic, social, or emotional issues, implementing programs to create a safe and supportive learning environment, and purchasing and using technology tools to improve student learning outcomes. By effectively utilizing Title IV Part A funds, schools and districts can create a more equitable, engaging, and successful learning environment for all their students. The examples on the screen are another list of possible activities districts could fund through Title IV Part A. Districts must be familiar with state academic requirements to ensure there are no supplant issues. ESE staff, as well as our Title IV Part A Capacity Building Initiative, are available to provide guidance to districts who may be concerned about possible supplant programs. While Title IV Part A provides funding for specific content areas, districts do have some flexibility in how they allocate those funds, allowing them to tailor their programs to meet the unique needs of students in their community. The goal is to ensure that districts can use Title IV Part A funds to make a positive impact on student success. Districts in Texas are required to demonstrate how Title IV Part A funds are being used to improve student outcomes. This accountability is achieved through annual performance reports submitted to TEA that detail how funds are being used and the impact these funds are having on student achievement. TEA may also conduct monitoring visits to districts to ensure that funds are being used appropriately and effectively. Districts must make information public about how Title IV Part A funds are being used and the results of those efforts. By holding districts accountable for the use of Title IV Part A funds, TEA ensures that these funds are being used to benefit students and improve their educational outcomes. Title IV Part A fosters collaboration by promoting partnerships between school districts and community organizations to share resources, expertise, and best practices. By supporting collaborative planning efforts that allow stakeholders to work together with districts to develop comprehensive strategies, and fostering shared ownership among stakeholders, leading to a greater commitment and sustainability of programs.
The Comprehensive Needs Assessment is the first step in TEA's continuous improvement cycle, and it is designed to help schools develop a clear focus leading to improved student performance. You can find the CNA statutory requirement in ESSA Section 4106 D1, 2, and 3. An LEA that receives a Title IV Part A allocation of at least $30,000 is required to conduct a comprehensive needs assessment every 3 years. Best practice, of course, would be to conduct the CNA annually. LEAs that receive an allocation of less than $30,000 are not statutorily required to conduct a needs assessment, but it is highly recommended. Besides Title IV Part A, there are several other federal programs required to complete a Comprehensive Needs Assessment, or CNA. Title I Part A, Title I Part C, and Title IV Part A are all statutorily required to complete a CNA. For Title II Part A and Title III Part A, the CNA is highly recommended. Before the CNA process can begin, the district or LEA must put together a group of stakeholders. ESSA Section 4106 C2 defines the CNA stakeholders that must be involved in the CNA process. These stakeholders are listed on the next slide. The following are required stakeholders: parents, students, private school officials, specialized instructional supports personnel, local government, community-based organizations, principals, teachers, school leaders, Indian tribes or organizations, others with relevant and demonstrated expertise, and charter school leaders if the agency or consortium supports charter schools. Specialized instruction support personnel is defined at the bottom of the slide. This includes personnel such as school counselors, social workers, psychologists, and others. Information regarding Indian tribes or organizations can be found at the link to the Texas Politics Project on this slide and on the resources page of this slide deck. Indian tribes and organizations are known to exist in Region 6, Region 19, and Region 20 at the time of this presentation. If your district does not have all the required stakeholders, this must be noted on your sign-in sheets. For example, your district may not have any charter schools located within its boundaries. This should be indicated on any sign-in sheets required for documentation. Here are a few more important things to note regarding required stakeholders. Click to the next slide. It is important to note that different federal programs require different stakeholders, and that if that stakeholder ends in an S, that means there must be more than one. For example, teachers. Teachers can also not serve as a parent. Secondary students may participate, and community members must reside in district, and they are not a parent or an employee of the district or school. Districts should do their best to make contact with all stakeholders. Evidence of outreach should be maintained even if the stakeholder does not take part in consultation. In today's busy world, a district or campus may need to get creative to collect stakeholder input. See the next slide for a few ideas. There are many ways to gather stakeholder input. Here are some suggestions. Use QR codes to collect information. These can be displayed at sporting events or other school functions. Have parents complete a short survey while they wait in the pickup line after school. A district could even provide some perks, like special seating at a school event for attending a short meeting before the event. Please note that federal funds cannot be used to purchase food, gifts, etc. For more information on Title IV Part A use of funds, see the General Resources on the Title IV Part A TEA webpage. Now that we've addressed the CNA requirement and stakeholders, it's important to understand the process of the CNA. First of all, the CNA keeps your district or LEA in federal program compliance. The CNA allows for coordination of federal programs to create a culture of continuous improvement and maximize the use of your federal funds. Working together is a process, but when done well, it makes efficient use of everyone's time. As I said earlier, the CNA is step one of TEA's continuous improvement cycle. Here, the district or LEA will identify local needs. Region 20 has developed an outstanding toolkit to guide schools through the CNA process. The Region 20 CCNA Toolkit will guide districts or LEAs through the process of gathering and analyzing data, defining needs and priorities, and connecting the needs and priorities to the district or campus improvement plan. The toolkit provides a wealth of information and sample templates that you will see on the next slide. Detailed timelines, a stakeholder invitation, meeting templates, sign-in sheets, probing questions, and a self-assessment and reflection are just some of the helpful templates you will find in the toolkit. The CNA process is a collaborative process. See the next slide to look at some steps. The CNA is a collaborative process. It's important to remember that a process is not a one-time event. It's not likely that stakeholders can meet one time and cover all the areas of focus. In step 1, the school will develop the purpose and outcomes for conducting the CNA. In step 2, focused area committees will be developed for each area. In step 3, we'll determine which types of data will be collected and analyzed. In step 4, we will determine areas of priority and summarize needs. And in step 5, we'll connect the CNA to the district and campus improvement plan. Some potential focus groups might include demographics, student achievement, school culture and climate, staff quality, recruitment and retention, curriculum instruction and assessment, parent, family and community engagement, school context and organization, and technology. Data will need to be collected regarding students, staff, parents, and community, and the district or LEA facilities. You will find a link here to possible sources of data that might be helpful. This information does not come from one particular source, but from a variety of sources. After gathering the data, stakeholders will need to review and analyze the information. Each of the bulleted areas on this slide should be considered. The link on this slide will take you to a series of questions to consider under each bulleted area. For example, when considering demographics, what do enrollment numbers indicate? What are the staff demographics? Or what is mobility and/or the stability rate for this campus? As you can see, the CNA can be a cumbersome and lengthy process. It's very important to communicate with stakeholders, plan ahead, and calendar meetings. Timelines for the CNA will vary among districts, but it's typical to start the process in February because a draft plan should be in place before a district submits their ESSA grant application. Again, this is just a draft and can be amended as needed.
The purpose of objectives and measurable outcomes is to help school districts document how they will spend Title IV Part A federal funds to make the biggest impact on improving student achievement. Title IV funds are used to pay for activities and services that go over and above state requirements. Public school districts that choose to take these federal funds must follow a simple 4-step process to document the appropriate use of those funds. Step 1. Districts must identify the greatest needs based on completing a comprehensive needs assessment with all required stakeholders. Step 2. Districts will use those identified needs to write 2 high-quality objectives and measurable outcomes. Step 3. Districts will continuously monitor the progress made on the 2 objectives and outcomes over the course of the school year. At the end of the year, the district will determine the level of progress made. Step 4. Districts will publicly report the progress made to their district stakeholders and also to TEA. If the progress did not meet 100% of the intended goal, the district has the option of repeating or continuing that objective and outcome into the next school year or write a totally new objective and outcome. This is a continual process cycle that districts must repeat each school year. The first step is to determine activities based on identified needs. This requires that the district complete the Comprehensive Needs Assessment or CNA process. Once those needs have been identified, the district must determine whether the activity is an allowable use of funds. The district must answer the following four questions. First, what specific need identified in the CNA does the expenditure address? Second, is the expenditure reasonable and necessary to carry out the intent and purpose of Title IV, Part A? To go over and above in one of the three content areas: well rounded education, safe and healthy students, and effective use of technology. Third, how are the expenditures supplemental to other non federal programs? In other words, are these funds being used to meet a state requirement, or are they supplanting state or local funds? Fourth, how will the expenditure be evaluated to measure a positive impact on student achievement? The district must maintain contemporaneous documentation. Examples of documentation include meeting attendance rosters, needs assessment documentation, and progress monitoring and/or final results. Once the district has identified an allowable activity, it must determine how to spend its Title IV funds. The district must determine the amount of Title IV Part A funds received for the current school year. TEA has released the 2024-25 ESSA planning amounts by LEA, which shows the amount received by each district. If a district received greater than $30,000, the district is required to conduct a comprehensive needs assessment, or CNA. Also, the district must address all three Title IV content areas: well rounded education, 20%, safe and healthy students, 20%, effective use of technology, 15% cap. LEAs may not use more than 15% of Title IV funds to purchase technology infrastructure, regardless of the amount received. The remaining 85% must be used for staff professional development in the use of technology. If the district received less than $30,000, the district only has to spend their Title IV funds in one content area. Also, it is not required to complete a comprehensive needs assessment, but it is considered best practice. The overarching goal of Title IV Part A is to increase the capacity of local education agencies, or LEAs, in the following three content areas: well rounded education, safe and healthy students, and effective use of technology. The state priority for Title IV Part A is safe and healthy students, which is to improve school conditions or the environment for learning. Well rounded education, the goal is to provide an enriched curriculum and educational experiences for all students. Effective use of technology, the goal is to improve the academic growth and achievement and increase digital literacy. The chart provides sample subjects or topics relevant to each content area. When writing high quality objectives and outcomes, there is no right or wrong way to engage in this process, but it is easier to start from the end and work backwards. In this case, determining outcomes or end results is the first step, followed by writing objectives, which are activities or interventions that the district or LEA will implement to meet those outcomes. So, we need to understand that outcomes are broad, big picture end results. Objectives are actionable, incremental steps to achieve those outcomes. Objectives include specific tasks, interventions, or events the district will implement for its identified stakeholders, which are students and or educators. For example, direct services for students, professional development, and supplemental resources and equipment. Here's an example of writing objectives and outcomes. Remember that there is no right or wrong way, but it is easier to start with writing the end result, the outcome, and then writing the objectives, which are activities or interventions. Let's read the outcome and objective. First, looking at the outcome, ABC High School will raise math student achievement scores by 10% on a state assessment by June 2025. Now, the objective. During the 2024-25 school year, ABC High School will increase math achievement scores by 10% on a state assessment by using Title IV funds to purchase additional graphing calculators in secondary math classrooms. Remember, outcomes and objectives can be written as one sentence or as multiple sentences. There is no requirement to keep them together or to separate. District question. Once the district has identified the need and written an objective and outcome, how will the district track their progress over time? Answer: SMART goals. Objectives and outcomes must be measurable over time. That is why we recommend using the SMART goal process. The SMART goal acronym is not endorsed by TEA, but simply a recommendation to ensure objectives and outcomes are high quality and meet the intent and purposes of Title IV Part A. Let's look at the 5 required elements to make an objective and outcome a SMART goal. Here is the SMART goal acronym. We recommend using these 5 SMART goal elements to ensure that objectives and outcomes are measurable. Specific identifies population and location. Measurable means an indicator of progress or improvement from one level to another level. Attainable means it doesn't overestimate the likelihood of completion. An example might be all or 100%. A good example would mean 75% of the students move from needs improvement to proficient. If it's attainable, it aligns with the Title IV use of funds criteria, reasonable and necessary. Relevant means in line with the district or campus mission. It aligns with one or more of the Title IV Part A content areas: well-rounded education, safe and healthy students, and effective use of technology. Time-bound means a time period. Example, 1 to 6 months or 1 or more years. To move from a baseline, example might be needs improvement to proficient. The last 2 elements are optional. Inclusive includes all students impacted by the process, such as students with disabilities or English language learners. Equitable provides a complete or systemic representation of the intervention's impact on students. In other words, it eliminates any unintentional or disparate impacts, such as inequity or exclusion. Now that we understand the intent of each element, let's look at the question prompts. Asking these 5 questions will ensure the objective or outcome is SMART. Ask: who? Specific: will do what? Relevant: by how much? Attainable: with what instrument? Measurable: by when? Time-bound. So, let's look at a sample SMART outcome and objective. They have been highlighted to identify each of the 5 SMART goal elements. Read the outcome. ABC High School will raise math student achievement scores by 10% on the state assessment by June 2025. What are the 5 questions to ask? Who? ABC High School. Will do what? Raise math student achievement scores. By how much? 10%. With what instrument? A state assessment. By when? June 2025. Does this outcome contain all 5 SMART elements? Yes. Now let's read the objective. During the 2024-25 school year, ABC High School will increase math achievement scores by 10% on a state assessment by using Title IV funds to purchase additional graphing calculators in secondary math classrooms. What are the 5 questions to ask? Who, ABC High School, will do what? Purchase additional graphing calculators in secondary math classrooms. By how much? 10%. With what instrument? A state assessment. By when? 2024-25 school year. Does the objective contain all 5 SMART goal elements? Yes. Once LEAs have identified and written high quality objectives and outcomes and provided activities and interventions, it is important to collect and use data to continuously monitor program implementation. Therefore, districts must monitor objectives and outcomes on an ongoing basis to determine if issues arise and make course corrections to keep the intended outcomes on track. Monitoring is not a one time process, but should occur at the beginning, middle, and end of an activity. If implementation is going well, then track the reasons for success. If not, the district needs to determine what needs to be improved and what adjustments need to be made to resources, timelines, inputs, and other factors. To monitor continuously, LEAs need to collect the correct data, so they must ensure that measurement is built into the process. This progress data is critical information and will ultimately be used for reporting final outcomes. Districts must track the level of progress made on each of their 2 objectives and outcomes over the course of the school year. That is why utilizing the SMART goal process is so important. SMART goals ensure that the objective and outcome are measurable over time. Districts must determine the level of progress made using one of the following percentages: minimal measurable progress, 0 to 25%. Some measurable progress, 26 to 49%. Substantial progress, 50 to 99%. Outcomes met, 100%. If the district did not make 100% progress on their 2 objectives and outcomes, the district can choose to continue with the same objectives and outcomes the next school year. However, they will need to provide documentation on how the money was spent and if any carryover funds were rolled over from the current year to the next school year. So, the district must answer the question: is the objective and outcome written in a format that can be progress measured using the above scale? If so, the objective and outcome meets the SMART goal requirements and we can move on to the last step. Title IV Part A statute requires districts to report program outcomes to all stakeholders. Transparency is important to ensure the effective use of federal funds. Second, it is critical that districts create a communication plan to share outcomes with stakeholders the program serves and to inform them about the services it seeks to improve. Here are some recommendations for districts to consider when developing effective communication plans. 1. Align communication goals with Title IV Part A program goals. 2. Target program-specific stakeholders. 3. Clearly identify specific information to share and how it will be shared. 4. Designate a timeline for communication. 5. Identify the format for dissemination, which will depend on the target audience. Some examples include a website, data dashboard, infographic, social media, executive summary, part of a comprehensive program evaluation, parent night meeting, teacher training, a conference, or webinar.
In this next section, we're going to talk about the requirement that Title IV Part A funds are used on research-based and proven effective strategies. When we look in the Title IV Part A statute, it charges LEAs to use programs or activities that are evidence-based. This requirement applies only to the drug and violence prevention program and activities under the Safe and Healthy Students content area. For all other areas, it's recommended, but it's not required. So why do we have the requirement that when we expend our Title IV Part A funds, that we're doing that on something that we know is proven effective and proven to work? Well, if we're going to be able to identify the needs of our students, then we also need to be identifying strategies that we know work to be able to meet those needs. That way, we're not wasting money, time, and effort on activities we just hope will achieve the goal we want. So, as we proceed forward, we're going to look to see how do we choose an evidence-based program. We're going to see what maybe steps we need to take as we go through trying to figure out what our needs are and then what evidence-based programs we can choose to do that. And then finally, we're going to show you some resources that can assist your district in that process. So, research-based, proven effective, evidence-based programming. When we say those statements, there's certain things that we're going to be looking for to demonstrate or show that a program is evidence-based. If we look at the What Works Clearinghouse webpage through our federal government, they've classified it into 4 different tiers. Tier 1 has strong evidence that this program or activity will achieve the goals that your district is setting out to achieve. Tier 2 shows that there's moderate evidence in achieving those program goals. Tier 3 is promising evidence, showing that that activity or program is promising on being able to meet those goals or needs. And last is a Tier 4. It demonstrates a rationale, but it may not have a well-designed, implemented experimental study to back that up. So let's look at study design. One of the first things that we look at is the program or the activity that you're looking at doing with your district, does it have evidence to work? Well, one way I would know that it would have evidence is that there's a well-designed and implemented experimental study to back up that when I do this activity, it will have this result with these types of students. When I look at a Tier 1, they have strong evidence because of a well-designed implemented experimental study. Tier 2 would show moderate evidence. That means that there's a well-designed and implemented quasi-experimental study. It may not have the experimental rigor of a Tier 1 program, but is still shown to work effectively. Tier 3 is promising evidence. It's a well-designed and implemented correlation study, statistically controlled for section bias. And then a Tier 4 would demonstrate a rationale. There's a well-defined logic model. It's based on rigorous research, but maybe there's not an experimental study that would back up that activity. So later on, when we look through the What Works Clearinghouse and you see a program is identified as either Tier 1, Tier 2, Tier 3, Tier 4, that's what they're saying that means. The other criteria to be able to look at is the results of the study. So that well-designed implemented experimental study, well, in a Tier 1 program, it was statistically significant to have a positive effect on what you were needing to impact at your school based on your needs assessment. Tier 2 also has a positive impact and outcome. Tier 3 also has those positive effects. And a Tier 4 shows there's been an effort to study those effects, and they're planning to do further research. So the results showed that it was significantly positive effect to the need that you have. The next criteria is to look from findings from related studies. So when people have introduced the strategy that you're looking at, was there no strong negative findings also? What we found is in the past, there's been programs like DARE that would show that in some students, they showed strong impact to reduce drug use. But then for other students, it actually made them more curious to be able to use drugs and actually had a negative outcome based on implementing the program. So a tier 1, tier 2, or tier 3 program shows that there's been no negative impact or unintended consequence from doing the activity or program that you're considering. The next criteria is to look at sample size and setting. So a tier 1 or tier 2 says that they've done this study with at least 350 participants. They've done it at one or more districts or one or more campuses, and it's had the same impact. So it's significant and positive in the impact that it's had on a sampled population that is more than just one place, one time. When I look at promising evidence or like tier 3 or demonstrating a rationale like tier 4, they haven't had maybe that number of at least 350 participants, or maybe they've only done it at one school district. The next criteria to consider when I'm choosing evidence-based programming is match. Is the district that they've studied this on similar to my population? If I'm in a rural school, I want to make sure that this has worked with other rural schools across the United States and not maybe just only urban schools or suburban schools. So making sure that the study has a similar population match or setting to yours is really key when you consider those programs. A tier 1 or tier 2 would be similar in your population or setting, where tier 3 or tier 4 may not be able to have that claim of having a wide variety of settings that it's worked in across. If I go to the What Works Clearinghouse is one place that I could be able to look at these criteria. You could see that they have these set up as a tier 1 strong evidence meets without any reservation. So when I choose a tier 1 program, we know that this is a evidence-based strategy or program that works to meet the need that you need. Tier 2 meets it with or without reservation. And so it's very effective as well. Tier 3 or tier 4 doesn't quite have that level. You would really need to look at things like sample size or match when you're choosing those programs. So these are things to consider when I'm looking for evidence-based programs or strategies to meet my needs. Now, let's review what I need to do to be able to choose this program and put it into practice. So, steps to identifying, selecting, and implementing an evidence-based program with your Title IV Part A funds. Well, step 1 would be conducting a needs assessment. That is a program requirement that at least every 3 years you would conduct that needs assessment to be able to know what you're targeting with your Title IV funds. So how do I know what program I need if I don't know what I'm trying to change and or trying to improve? So conducting that needs assessment is this first step. The next would be inventorying your current programs and practices. What programs or activities are you already doing, and what is their impact? So it would be dangerous to maybe choose a program or spend Title IV Part A funds on a program and not know what we're already doing. So assessing what we're already doing, conducting that needs assessment, and assessing, would we be ready to implement a program? What do we have the capability to take on a new program or activity? The next would be to search for evidence-based programs. And we're going to show you several different resources to be able to do that. But as I'm searching for those evidence-based programs, looking for the need or the identified need that I need to be able to work with my students, being able to uh, target my searches by the type of campus I might be, or the type of needs I have, or the type of student that I'm trying to target is really key as I am looking for evidence-based programs. The next is to review evidence for each program or practice. Once I've done this, then I can move to step 3. I take that short list of evidence-based programs that I've researched and looked at and match it to my identified needs and my resources. I do this by being able to involve my stakeholders in that selection. So we've had our stakeholders help conduct that needs assessment. We've gone out and looked for programs that meet that need, that meet our demographics and meet our campus. And now we're bringing them back and saying, hey, these are the choices that we see. What do you think in our selection? And then next would be prepare and implement that program. Another key factor is to monitor the progress. So once we've implemented this program or activity into our school, is it having the result that we need, that our needs assessment said that we need to tackle? And so not just buying a program and doing a program, but monitoring whether that program is working is really key. So now that we've identified steps to choose an evidence-based program, let's show you some resources where you can find evidence-based programs and be able to bring those to your stakeholders. So one of the first resources we have is the What Works Clearinghouse. The good thing about the What Works Clearinghouse is, one, they have that rating system that we talked about earlier. They identify programs as either a Tier 1, Tier 2, Tier 3, or Tier 4 program. And so I can know when I look at the programs and I'm choosing those programs, I can look and know what level of research-based, evidence-based, proven effectiveness is involved in that program. The other good thing about the What Works Clearinghouse is that I can search it in multiple different ways. I can choose to search by what is the need that I'm targeting. Do I need violence prevention? Do I need a drug prevention program? Maybe I need a social emotional program to be able to help my students. So, one way to search the best practice clearinghouse is by what is the identified need. Another way to search the clearinghouse is by what is the setting that it could be used in. And so I can go through and maybe search, I need a large school district type program that has been research based and proven effective to work in those settings. Or I need a small rural school setting program that's been shown to work there. So identifying the type of school or the type of setting that you're going to implement the program in is another way that I can search on the What Works Clearinghouse. One of the other ways I can search is by what type student I'm looking for. And so that could be searching by grade level or searching for a particular type of setting that the students may be in. And so as I go through, I can use this resource to be able to search for lots of different evidence based programs uh, to be able to meet the needs that we've identified in our needs assessment and use our Title IV Part A funds effectively. Another resource that we'd like to show you is the National Registry of Evidence Based Programs and Practices and the Substance Abuse and Mental Health Services Administration web pages. On both of these web pages, you have a section entitled Evidence Based Practice and Resource Center. So on this, I can do a filtered search for evidence based programs and practices. I can do that by the resource topic. I could maybe choose I need tobacco prevention or I need alcohol awareness. I can go through and search for who the target audience is or what resource type I need. I need training for staff or I need a program for students. And so as I go through this registry, I can search and filter my search results for several different programs that could meet the needs that we've identified so that I can bring those to my stakeholders so that we can use our Title IV Part A funds effectively on evidence-based research practice activities and programs. I hope this has helped you be able to understand this requirement in Title IV Part A program guidance and also be able to make effective choices to be able to assist your students to be healthy, safe, and well-rounded students. The last thing I'd like to do is go through some of the resources that were showcased in this presentation. So as we go to our resource list, there's several different resources, web pages that are both found in the state of Texas, in TEA, or across the nation that could be able to assist you in all these program requirements that we outlined in this presentation. We hope that this helps you be able to make good, effective choices for your students and so that you can use your Title IV Part A funds in the most effective way possible. Thank you so much for your time today.